that you kind of wanted to work on like your lower body today. It sounded like your ankle.
Yeah. So, and thanks for the explanation on the shoulder. Appreciate that. So I guess I'm also a runner. So I have put in a lot of miles in my life. Been running for like 15 years now. And basically I was running maybe three miles a day for a few years, maybe 6 at most, sprinkled in there. Pretty fast, but never had any issues because it was just, I wasn't doing super long distances. And about a year ago, I jumped up to 6 to 9 a day really fast, which I had the muscle memory for it so it didn't feel too bad. But, I was ignoring pain in my calves and stuff. And basically at the end of that 6-week period where I was ramping up the miles really quickly, I started feeling foot pain, like here.
Okay.
In my arch.
Yeah.
And then also here in my ankle. So I started researching it immediately and saw that I might have posterior tibialis issues.
Okay.
And that didn't shock me at all because I had extremely painful, what is this,
You gastroc?
Yeah.
Yeah.
That was really painful constantly. And I would just treat it when I got home every day, and it was enough treatment to be able to keep running. But I'm suspecting that I have soft tissue problems because they're just too tight for me to be able to treat easily at home, I guess.
Yeah.
But I don't know the leg muscles that well, but
So we're gonna do some exploration real quick. We're gonna move around in this.
Okay.
I'm gonna see if I can change this camera angle so you can see this. I think I'm gonna use my left leg here. And I'll get a blanket just so I can see if I can make this comfortable. I'm going to pull my leg out here. And then what I want to be able to do is like your tibia, the bone is right here. I want to be able to press in the soft tissue right next to it. And I want to start to like press in here and see like how this feels. Like
so sorry.
So I'm pressing, like along the calf. I'm working through here. And for me, what I notice is if I'm up near the tibia, like the tibia is bone, like there's not a lot there. But for soft tissue, if I'm right next to it, I start to get a little activity, like I can press in here and I start to feel it like run down.
Yeah, I actually tried that for only once. I was wondering what that was.
Yeah.
I pressed right next to the bone and I was able to recreate a lot of different pain I had. So yeah, I guess I never understood how that was. I don't know if
I mean, what it amounts to is like, I can't really do like a movement assessment of like your gait.
Yeah.
But the part of the issue is it's like when you run, I'm just going to ask you some basic questions. This is also giving people at home like a little bit of an idea of the stuff that I see. So I'm not much of a runner. I didn't like it in school.
Yeah.
I got some Vibram 5-finger shoes at one point and wanted to try because I had read information about barefoot running. When you run, do you run and hit your heel and then?
No, I don't anymore. I kind of run midfoot.
Do you have like minimalist shoes?
No.
Okay, so here's what I found. When I put on those Vibrams, I could run on concrete, but I ran on the ball pads of my feet. The challenge with that is my calves have to work overtime because my calves are acting like shock absorbers. Instead of just hitting and then running and hitting and running, now, yeah, I might feel like a gazelle, but whew, man, did it do a number on the muscles back here. What I notice is people who are having problems, especially, they'll come to me and tell me they have plantar fasciitis. They're having like inflammation at the bottoms of their feet. A lot of times what I find they're having issue with is typically soleus. Soleus is underneath the gastrocs.
Okay.
The gastrocnemius, gastro is from the same Greek root as like gastrointestinal bellies. But the soleus to me is the big workhorse. It's a muscle that's underneath excuse me, underneath the gastrocnemius. So that's the superficial layer. Those are the gastrocs. I could see those on you. And then that deeper muscle that you're maybe having an issue with is soleus. Soleus is the big workhorse in the lower leg, in the posterior side. So I can show you how to work on that. What I notice is people will wind up having issue. They'll say they feel it like in the bottoms of their feet. They'll say they're having issue with that. They do this all the time. I have plantar fasciitis, and then I'll take them and work on them. And I have to go very slow to try to work on this part of the calf, this posterior piece. And it's not just like moving it around and applying some sharp pressure. It's really broad, sustained compression that seems to help through there. The other thing is, have you worked on the feet themselves?
So I worked on, I don't remember the name of the muscle, but this one that causes pain here.
Yeah.
I have worked on that. I've like used the pen before and just put some pressure for a few seconds.
Yeah.
And felt relief quickly. So.
Okay.
Just this one. I think it's there, right?
Yeah. So you said earlier you have a foam roll available, right?
Yeah, I found it now.
Yeah, go ahead, grab that foam roll. I'm gonna pull this guy over and see if I can show this on camera. I'm on my mat, so I have a little bit less pressure. Like the mat has a little bit of give, but I'm gonna change this out and show real quick. So what I wind up doing if I do have a problem with this and decide I want to work on it, both the gastrocs and soleus, and I'll show those again real quick. So soleus is the deeper muscle. This is the one that, in my opinion, we're really trying to get to.
Okay.
But it's also the more superficial gastrocnemius. These two muscles are in the posterior, so they're a little challenging to get to, and I can probably show you just a couple of quick ways that I think you can address it. So one, if I need something broad, this foam roll is much broader than, say, my elbow. I can also position it in a way to be able to like, start to get into that muscle. I'm not pressing behind the knee. I'm just trying to get into that. Now, if I get to a spot and I'm like, ooh, right there, there's a difference with my foot between lengthening the muscle and then allowing it to rest. When I allow it to rest, it's tender. And then for me, I can roll my leg back and forth and start to rock that open a little bit.
Like this.
What I start to feel is this broad kind of sensation down towards my heel. Like it feels like it wants to go and wrap through my foot.
Is this proper?
How does it feel?
Ropey.
Ropey?
Like everything's tight.
So does it feel important?
Yeah.
Okay. Do you need more pressure?
I think so.
Okay.
The right side.
That's exactly what I was going to do. I'm going to see where we're at. I don't think I can kind of see it there. What I'm going to do is put the other leg on top, and then this leg is just going to be dead weight. Now, if I want more, what I can do is I put my weight into my hands and lift my body.
Okay.
Oh, eek. Oh.
Yeah.
Oh.
It's painful.
Now, what I can do is that leg, where I'm pressing into the gastrocs and soleus, I can start to, man, I got to back off for a second.
Yeah.
Because I'm shortening and lengthening that muscle, moving it around while there's that force. That's going to work really, really deeply and allow you a passive way of accessing it. Do you feel like if you were to use your fingers, for instance, do you feel like you need to go higher or you need to go lower?
I guess I would say a little bit higher if I'm on the back of the leg.
Okay.
And then the lower I get.
You have a tennis ball available?
Yes.
Okay. So this one's a little bit more complex, but I think this is going to help you with some of the pressure. So I'm gonna turn this way. They can probably see this pretty well. Let me see if I flip between these cameras, if this shows up. Yeah, that does pretty well. You got your tennis ball?
Yep.
Yeah. So what I'm going to do is I don't want to press in the back of the knee. I want to press into my hamstrings, and I want to press into the gastrocs and the soleus. Now I can find the spot and go, okay, right, yeah, right there. And then what I'm going to do is I'm going to use my upper leg to pin. Oh,
I never thought of that.
To try to pin that muscle right in there. So it's on my right leg right now. You can probably see this here if yeah. Oh, now my hamstrings feel like they just kind of slide out of the way, but that pressure, like I'm getting a referred thing like down here on the outside of my foot right here. Like I feel a sensation right there from that pressure. This is also a great because it doesn't like strain my hands. If I need to move it, I can always move it just a little bit higher or a little bit lower, depending on what I feel and depending on the size of my calves.
Okay. And I can go all along the width of the calf.
Say it again.
I can go all along the width of the calf doing that.
Yeah, there's nowhere in here, in my opinion, so long as it's not painful, you're not going to do any damage. It doesn't matter if you go further down. You don't want to put like extreme pressure right into the Achilles tendon right here at the back. You might want to come a little bit higher where there's muscle. And usually that's where people seem to get the most benefit in the shortest amount of time.
Well, I can feel some slight releasing or, you know, the starting of it, that when the muscle starts kind of wavy feeling. I do feel that a little bit actually. So yeah, that is really easy.
And the thing is, it's two quick ways, right? Now, let's say you built up to the point, because I'm going to show you a third. This is the same basic thing, but golf is very mean. That does not have much give, but it's much more pointed, kind of like an elbow. So the deal is you could use that in the same way you use the tennis ball. It's just that this is more precise and I think a little more angry. What I do is give you a broad way with the foam roller and then give you something sharper to continue working on it. You may find that the tibialis posterior, which you mentioned, and you may find that the soleus are causing issues, but mainly what I see in most cases, people are working on the gastrocs, which are more superficial, and then they're working on soleus.
So I guess on my right leg, I'm kind of putting the ball here. If I were to put straight down on the left side, and I can feel that pain in my ankle when I do that.
So you're pressing into the quad.
Oh no, in the hamstring, the ball's here.
Oh, okay.
Right here. Yeah, but I can't show directly.
Oh no, it's fine. I was just making sure I was understanding what you were saying. The visual is fine. So the deal is when you press into the calf, you're feeling that same referred pain.
Yes, on the left side of the calf if I press there.
Yeah.
So
I would just work. It's the same thing as the shoulder. I'm just giving you tools to try to work on the soft tissue part. I think that the soft tissue component is probably exactly what you're having issues with, but to me, you're a more extreme athlete. You're doing things and like pushing your body, which also means that you need more opportunity to be able to do like self-care and rehab essentially. You know, top level athletes have people who work on their bodies like this.
Yeah, I mean, I can probably do this each day after I run, right? A little bit, not a lot.
Yeah.
But
yeah. So the way it works, like I think you could work on it as much as you feel comfortable with. You don't want to cause yourself pain. It's almost like it's like getting a massage. Does it feel good? Cool. Is it causing pain and you're wincing? Okay, back off. Right now, just in that little bit I did, like this calf feels much more like spacious and open. But I didn't think that I had any particular calf tension.